and welcome to the YouTube channel Health Cube, the place where my mission is to motivate you to look at the brighter side of the health. In today's video, I'm going to talk to you about resisted exercises. Yes, this is everything you should know about exercise series, and in today's video, we are talking about resistance training. Resisted exercises are very popular and you must have done some sort of resisted exercise some point in your lifetime. Resisted exercises are part of exercises not only in the fitness regimes but also in the rehabilitation process. In today's video, what you can expect is understand the basics behind this resisted exercise. What are its benefits, what it works, how it works on the muscles, and what are the aims that you can achieve, and some principles behind the resisted exercise. Also, what are the contraindications and different types of resisted exercise. So if you are interested in knowing all this, make sure to watch this video till the end. So let's begin. Friends, resisted exercises are basically active exercises in which dynamic or static muscle contractions are resisted either by manual force or some mechanical external force. Resisted exercises are one of the most important elements of exercise training program. In any format of exercise you go, there is some sort of resistance element involved. Resistance not only improves the power but also helps to achieve next level goals for the body. Hence, it is very popularly not only used in the fitness area but also in the rehabilitation area. We as a physiotherapist use resistance training in managing multiple musculoskeletal as well as neuromuscular disorders like osteoarthritis, back pain, neck pain, shoulder pain, etc. The benefits that one gets through resisted exercises are: it improves muscle performance, it increases the muscle strength. Resisted exercise improves the bone mineral density and thus helps in preventing osteoporosis. It reduces stress in the joint. It reduces the risk of soft tissue injury. It improves person's balance. It decreases body fat and it improves the physical well-being of a person. Now, there are certain principles that forms the basis of resistance training. The first principle of that is also called as overload principle, which says that in order to achieve effects from resistant training, there has to be a load which has to be applied to the body which exceeds the metabolic capacity. What do I mean by this? If you want to achieve some level of benefit from a resistant training program, the amount of resistance that you give to your body should always exceed to the capacity. Then and only then the body will be trained and will push itself to achieve the benefits of resistance training, which is the improvement in the strength of the muscle. The second thing that is always kept in mind while designing resistance training program is that all the exercises should be specific enough to the functional goals of a patient. Or else a person, if your day-to-day activity involves a lot of use of hand, then the resistance training should automatically be focused on improving the strength of shoulder as well as arm or as hand muscles. If the function or the day-to-day activity involves a lot of use of leg muscles, then definitely the resistance training should focus on improving the leg muscle strength. So all the exercises that are included in the resistance training should always be parallel or else should be dependent on the functional tasks that a person has to do in his or her day-to-day life. And the third principle is that the resistance exercise has a reversibility, which means if you do resistance training for some period of time and then you stop doing it, then the effect of the entire resistance program gradually reduces. Which means if you do exercises and then you stop doing the exercise after 1 week, your body will start losing the effects of these exercises. Hence, consistency is very important when it comes to resistance training program. So these three principles are always kept in mind while any kind of resistance program is designed. Now, the thing comes, what are the types of resistance training? Now, here I'm not going to talk about different formats of exercise. Exercise can be in the form of HRX, yoga, Pilates, we know it all, right? But in all of these exercise programs, the basis stays the same, and these bases are the exercises types, and these types are: first, isometric exercise; second, isotonic exercises; and third is isokinetic exercise. Isometric exercise are very simple, which means in which the muscles are not moving but are contracting at the same place. These type of exercise are called as isometric exercise. A simple example, if I'm trying to press this hand tighter. So my muscles are not moving here, but they are internally contracting. So this is a format of an isometric exercise. The second is isotonic exercise, in which the muscle movements happens at different rate and speed. Isotonic exercise are again divided in two formats: eccentric and concentric exercise. Eccentric exercise, in which the muscles will contract and shorten, which means the contraction happens towards the body or is inside the body, whereas in the concentric exercise, the movements are focused away from the body or else apart from the body. So the muscles will lengthen and then the movement will happen. And the third is isokinetic exercise, in which the movements are happening, but they are happening at the same pace and speed. There's no change in the speed or else the contraction, which means the contractions are happening at an equal speed or else the movement is happening at an equal speed. Keeping these three principles in mind, or else three types of exercise in mind, other format of exercises are designed or else decided. So these forms the basis of resistance training. Now there are certain points where one person should not do resistance exercises. What are these points? First, if you are having pain, you should not do that exercise, which means if any kind of exercise which is a resisted exercise causes pain to you, that means definitely your muscle has undergone fatigue or some sort of muscle injury, for which you need to refrain yourself from doing that exercise. Second, if you are having any sort of inflammation present in the body, say you are having some sort of existing problem like tennis elbow, then you should refrain from doing any kind of resisted exercise until your inflammation has gone down or is reduced. The third contraindication of resisted exercise is cardiorespiratory disorder. If you are having cardiorespiratory disorder and you push yourself in doing some resisted exercises, then it could be harmful for you. Hence, it's important that all these exercise has to be done under supervision. And fourth one is open wound. Don't ever do exercises in the area which has got a wound, because when you do resisted exercise, there's a lot of muscle pumping action that happens, which increases the blood flow to that area, and your wound might start oozing out more blood. So keeping these principles in mind, resisted exercises are formed. So I hope you understand what are resisted exercise and what are the important points or else the benefits of this exercise, and why it is important to incorporate resisted exercise in your day-to-day exercise program. I hope you found this video helpful. If yes, make sure to like this video, share this video, and don't forget to subscribe to HealthQ channel. I'll see you in another video. Thank you.